Let's go ahead and get started with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Welcome. Good morning, everyone. It's Monday, March 10th. This is the Shawnee County Board of County Commissioners work session. It's a full agenda today. Quite a variety of topics we're going to cover. And so I believe, will have an executive session today, though, also. Is that? For
employee evaluations.
Yeah, to do employee evaluations. So I don't know, the clerk's not here, but
I can work real quick.
if somebody wants to maybe send her a text for when we do that, so that she can record that. So I'm Aaron Mays. I'm the chair this year, represent District 3. On my left is Commissioner Bill Rippon, representing District 1, and on my right is Commissioner Kevin Cook, representing District 2. And then our county counselor is back from his vacation, so welcome, Red Checker.
Hello.
All right, let's go ahead and get started with our first topic today, which is an MTAA update. So, welcome, guys.
All right, thank you. Good morning, Commissioners. Good morning, County Councilor. My name is Mike Munson, and I'm one of the MTAA Board of Director members. And on behalf of the MTAA, I wanted to say thank you for your time today. Curtis Sneed and I are here, and we're going to present a brief update on where we are with aviation in Shawnee County and Topeka. Eric Johnson, the MTAA president, was going to join us today. However, he had a family medical emergency that just hit yesterday, so he's unable to be here today. So with that, Curtis, you want to get started?
Thank you, Mike. Good morning, Commissioners. It's nice to see all of you. It's a pleasure to be back. I have found that every time I speak about the MTAA anywhere in the community, questions arise which lead me to appreciate that it never hurts to just set the groundwork and touch upon who we are, where we came from, and what it is that we do in the community, because even folks who have been here for a long time appreciate the reminder. So just very basically, you know this, but the MTAA was created by the city of Topeka in 1974 following deactivation of Forbes Air Force Base. The statutory language that enabled the creation of the Joint City-County Authority in 1978 tells you what our essential mission is: to acquire, own, maintain, and take care of and improve the airport facilities in Topeka and Shawnee County. So we, generally speaking, think in terms of three realms for which we are responsible. Topeka Regional Airport, which of course is the large airport south of town. Many of us simply refer to it as Forbes. Immediately adjacent to that is the Topeka Regional Business Center. That is our industrial park right next to the airport. And we also own and operate Philip Billard Airport in northeast Topeka. A surprising number of people who are lifelong Topekans like myself will ask me about my job and say, "Oh, you guys do Philip, you do Billard as well?" So it never hurts to pause and remind ourselves of that. Let me just run with this. Okay, go ahead.
Brief overview of our operating structure. As everyone is aware, I believe we have a 5-member board of directors, 2 of which are appointed by the county and 3 of which by the city. Our current board is myself as chair, Brian Armstrong, Michael Odepatan, and Carlos Cortez, and Sam Sutton. Just so everyone on the commission is aware, Mr. Sutton is a business operator that has a business based at Billard. And Mr. Armstrong is an engineer in town. So with that and with Carlos and Michael's business experience, we believe the board brings a lot of diverse experience to the board. And we're very excited about the current structure of our board. Everyone is engaged, excited, and ready to work hard for aviation in Topeka.
So Mike, in 2024, the board took some measures to try to tap into that experience and diversity and make the board even more supportive of what we're trying to do. You updated the bylaws that had been in place for quite a while. The board adopted a code of conduct and has also established new committees. Now, as you would know, when you have such a small board, committee's kind of a tough thing, because when any 3 members of our board get together, it's an open meeting, the same way any 2 of you get together. So we have 2 directors per committee on our Budget and Finance Committee, our Economic Development Committee, and then our Operations and Maintenance Committee. But breaking that down so that we can have offline discussions about topics and dig deep outside the context of our board meetings enables us to study and make better progress on those topics.
And regarding those committees, we meet quarterly, and if you have any specific issues, commissioners, that would fit the bill of any of those specific committees, reach out to me directly and I can get you those committee members. Obviously, you guys have been very supportive of the MTAA and provide a lot of valuable input, so we always welcome your advice and expertise in any of those issues.
You also see there a quick rundown of the way the company is, or the agency is structured. Eric Johnson is in charge of the whole shop, and we've got several departments there. We've got a large police and fire department, airport operations, a big maintenance crew. Up at Billard, we provide what are called fixed-base operator services, which I'll talk a little bit more about in a second. And then we have our admin and finance team, and then our economic development team, which essentially is me and Dina, who's my leasing administrator. We derive our revenue from essentially 2 big sources. One is the property tax that all of the taxpayers in Shawnee County pay. We have a mill levy. We're right there on the sheet with the county and everybody else, like the library and the school districts who collect property taxes. And then we also get a lot of our revenue from the rental of our properties, and every time fuel is put into an airplane at either airport, we get some money off of that. We also receive enormous amounts of money through the Federal Aviation Administration. Those are usually very directed, targeted grants that are for specific projects. So we don't really contemplate those here, because that's not operational money. It comes to us for one purpose, to redo a taxiway, and then that's it. This layout suggests a couple of things. First of all, we are bound, the same way you are, to manage our assets and try to optimize the taxpayers, the return on the taxpayers' dollars. We are bound by federal regulations to work towards financial self-sustainability. Whether we get there or not, it could depend on facts on the ground, but in other words, we're not just an ongoing sort of charitable endeavor or a loss leader of some sort. We're supposed to be a sustaining business. And we are obligated by federal law to make our properties available to all types of aeronautical activity. We are not able legally to just, focus in on certain, tenants that we like and exclude others. Now let's talk about some great things that have happened at our facilities. And I'll start over at Philip Billard Airport. Mike already knows this because he's an aviator. He has a plane over there. But I've been delightfully surprised at how much energy there is at Billard Airport, how much entrepreneurial energy has sort of come out of the woodwork in the last couple of years. We did construct a new terminal building over there and brought in a new food service provider called Sky Restaurant. Hopefully you've all had a chance to go over there and enjoy their offerings. Just on Thursday, I was eating breakfast over there, and the precise phenomenon that we were hoping for took place. This plane pulled up, these ladies got off and came in to eat breakfast, and I went over and chatted with them. They were from Kansas City. They had come over here just to try the restaurant. We hope to have more and more of that sort of air traffic as people come in to take advantage of our amenities. I noted that we, the airport, or the authority, are the fixed space operator over at Billard. That means fundamentally we're the ones who put the gas in your plane. There's a lot more to it than that. They provide kind of a concierge service, but that's what an FBO does. And thanks to their good service and their focus on that little team over there has actually increased that line of business pretty materially. They have attracted more and more military traffic in the form of those Apache helicopters you see there. So we're excited to see that grow. And that's part of our future strategy, is to make Billard the sort of place that if you are an aviator from someplace else, you've got choices. If you're flying across the country, we want you to choose Topeka, and we want you to have good reasons to choose Topeka. And I think we're establishing those reasons as we go here. We've also improved and expanded the maintenance operation over at Billard. And when I say we, I'm referring specifically to a tenant that we already had who expanded and has taken over our, we call it MRO, maintenance, repair, and overhaul facility there. And they have really put that back on the map, where other airplanes are coming into Topeka to be worked on, and they are driving traffic in and of themselves. So we're very proud of that development. And our own team has worked very hard just this last year and a half to bring our T-hangars up to a better state of repair and restore the properties over there. So there's been a lot of hard work that's brought the airport to where it is now. Looking forward, we are very excited that another of our tenants who was already there came to us and said, I have an idea for a flight school. He already runs a small flight school, but he said, how about if I take over the old terminal building, I will rehab it, and I will turn it into a flight academy that will allow me to expand and do more elaborate things with that. He's also going to be building a hangar right next to that flight academy. So over the next couple of years, we expect to see a lot of construction and good new activity there as he fulfills that. We are in the process of researching a new fuel farm, which is necessary because our existing fuel farm is older than probably everybody in this room, I think. So we need new fuel tanks above ground, and we're going to equip the new fuel farm with a self-service mechanism that will allow our base aviators to just come up and fuel their own planes. There are a number of projects that have to do with the infrastructure at Billard, including taxiways that will be rehabilitated, runways need to be lengthened, and we're going to be working to complete that perimeter fence all the way around the airport, which will have the benefit of keeping deer and other wildlife off the runway, but it will also create a secured operating environment within which our high-tech tenants can operate, and that will enable them to be more competitive as they pursue sensitive contracts. So that perimeter fence has the effect, even though it's maybe the least glamorous aspect of our capital plan here, has the effect of really posturing us to become a boutique high-tech hub over there in Oakland. We are looking forward to that. So our other big airport is Topeka Regional, or Forbes. Major accomplishment over the last couple of years, a new fuel farm down there as well. That is online and working. We're nearing the completion of a project which, when you look at it from Google Earth, it seems a little trivial, but when you actually go out there and walk around and see how much concrete is involved, you realize it's a unbelievably large construction project, and it simply has to do with changing one of our taxiways. It was built historically so that it intersected the runway at an angle. That's no longer the way the regulations read. Taxiways are supposed to intersect the runway at a right angle so that the pilots can see better. It's simple in concept, it's huge in execution, and that's very close to being done, and it ties in nicely with the potential development at the north end of the field, the 190th Air Refueling Wing. You've probably read. They are one of 7 units in the country that's still in consideration for a new home for the KC-46 refueling jets. We would have done the taxiway thing either way, but having our infrastructure up to that level dovetails nicely with the fact that we may be having some larger aircraft coming in for the 190th. Hopefully a number of you were able to attend the air show, the 2024 Thunder Over the Heartland. I would say we're proud of that, and of course we are, although frankly it was Veris Aviation, one of our tenants, who really led that charge, and we're very proud of them for the gift that they gave to Topeka in October. If you got to go, I don't need to say anything else. If you didn't get to go, you're probably tired of hearing about it, but it was an amazing experience, and I think the Veris team are planning to recreate that maybe every other year. Along those same lines, Veris is one of our premier tenants out there at Topeka Regional, and we completed a transaction with them that will involve the expansion of their footprint at Forbes and enable their business to grow, and they have undertaken that. It won't be long before the skyline is going to look different because of Veris. And then finally, it's worth noting that my little team, mainly my leasing administrator, has worked tirelessly over the last year to rent out our smaller buildings out in the industrial park and drive up the rental rates to a more market-oriented rent and attract good tenants out there. And as a result, our rental income from those properties has gone up materially. So we're very happy to see that part of our business grow as well. We intend to keep pushing on that. We are scheduling renovations to our office building, and we have suffice it to say that if you go out there for a board meeting, next year you will be in an environment which I think will be considerably more modern and inviting. And we've also learned, much to our delight, that our maintenance crew isn't just about fixing broken water pipes or air conditioners. We have some in-house talent that can do some fairly sophisticated remodel work themselves. So a lot of the work we're planning on our office remodel will quite possibly be carried out by our own team, which should be very cost effective. And we are working constantly with the Kansas Department of Commerce and federal agencies to make sure that they understand what we're trying to do, and we stay in touch with the opportunities they present. So I will bring this to a close by focusing on what are probably our two most conspicuous initiatives. One of them I know we chatted about last year, and that is the 80,000 square foot maintenance, repair, and overhaul hangar project out at Forbes Field. That is still in full steam ahead. We have identified a site for that hangar, which is, if you were at the air show, you probably walked right through it. It's right behind our office building out there. It turns out to be a perfect site for a structure that size. And we are working with our state delegation and some our local financial consultants to put together the financing package that will make it possible to build that structure and bring it online. As it happens, we are in very serious conversations with an international firm that has studied up on Topeka, likes what they see, and would very much like to move a part of their operations here if the hangar is built. So it is great timing that we can tell our senators that if they move forward with the funding for that, we have somebody who's very much knocking on the door. We would anticipate being able to sign a deal with them in fairly short order. Because hangars that size are needed, but there aren't very many of them. So we will be positioning ourselves in a unique way once we get that hangar built. Secondly, we are back and more aggressive than ever in terms of attracting commercial air service to Topeka. Everybody in here pretty much was around 10 years ago when we tried that experiment with United Airlines. We know how that ended. We have a different type of strategy this time, which I won't delve into here, but suffice it to say that what we know about ticket sales now, what Topekans buy, convinces us that a route from Topeka to one of three cities, either Orlando or Phoenix or Las Vegas, could fill several planes a week. Literally, something like 274 to 300 Topekans drive over to Kansas City every single day to fly to one of those three cities. The broader picture is that every single day, between 1,300 and 1,400 Topekans drive over to KCI to fly somewhere. We're focused on those three cities because the data make it very clear that if an airline, like, say, Allegiant, were to establish a route from here to, say, Phoenix, they almost couldn't possibly lose. Those planes will be full. And once those are full, then we fully anticipate negotiating the addition of other routes. So we are very focused on, there are only two capital cities in this country that don't have air service. And we fully intend to remove ourselves from that list. And I don't know who the other one is, frankly, but let them be ashamed on their own. We're going to have air service in this Topeka, in this city. We're the capital city of Kansas, and this is the way it should be. So you'll be hearing a lot more of that. We have a fairly major marketing campaign plan, but we're excited about winning air service back to Topeka in a way that will be a victory for the airlines and for us. And with that, I think Mike and I would be happy to answer any questions you might have.
Questions?
No.
Got a couple. Curtis, can you go back to your second slide, the very beginning, where you talked about the formation? There you go. So this is a good slide for us to start. Maybe my kind of questions or inquisition is, so in 1978, the city and the county formed the airport authority known as the MTAA. And you, as you go on to the, I guess, the next slide over, or two slides forward, we have individuals that are appointed, one more slide. We have individuals that are appointed by the city, we have individuals that are appointed by the county. And as part of this authority, you guys set a mill levy for the maintenance of those three facilities, the Billard, the Forbes, and then also the airport, the warehouse.
Industrial
workforce.
park.
Industrial park.
Mhm.
So we will get questioned regularly by taxpayers and by constituents saying, what are you doing to try to control, or what authority do you have to stop the mill levy with the MTAA? We had asked the same question with the library, so you're not alone, but so what does the MTAA look at when they're looking at that mill levy? Because you are acting as appointees, unelected individuals that are affecting the mill levy. Where do you guys look at when you're looking at property tax?
Do you want to?
Well, I mean, from my perspective, obviously, our goal is to keep it as low as possible and be the best stewards possible with the taxpayers' funds. And with that, I would say, just at our last MTAA board meeting, Curtis has been on staff for, over a year and a half now. And obviously, he's our development director and leasing agent. And with that, we just got a report we're $330,000 over budget on our leasing revenue. Mm-hmm. So with Curtis and his team, we see the ability to go forward to try to eliminate the tax burden by increasing leases, revenues, and other sources coming in to eventually bring that down. I know that hasn't happened yet, and that's probably because we're looking at a lot of deferred maintenance issues that we're addressing, and frankly just cost a lot more in today's environment than they have in the past. But do you want to piggyback on that, or?
I think that would encapsulate our approach. It's also true that some of the larger visions that we have won't be possible unless we find some ways to finance them that we haven't previously. We anticipate taking advantage of our bonding authority. If we get that big hangar, the state funding for that, we're going to have to come up with some matching money that will entail going to, acquiring private dollars through the vehicle of bonds. And that will play into the overall fiscal picture. But I can tell you that certainly Eric and his team, and I guess that includes me, we never lose sight of the fact that the taxpayers are our shareholders. So it's not our money to spend, and we manage it as carefully as we can.
Well, I can tell you that I get asked regularly by taxpayers, the constituents, about what can you as the county commissioner do to set the mill levy by the MTAA, set the mill levy for the library. And at this point, we really don't have the ability or authority to affect the mill levy that's set by the MTAA or the airport authority, or by the library. But, I mean, those are things that we get asked on the regular, what influence we have, what control we have. And as the legislature, as you might be well aware, they're very concerned about property tax and looking at changes to the property tax formula that would affect not just the city and the county, but also affect these authorities, such as the library and the airport authority. But as we go on, looking at the airline service, Topeka, we fall into that weird category where we're too close but too far. We're right in that midpoint with being able to get to the Kansas City International Airport within an hour or just a little over. Manhattan has a air service, Wichita has an air service, but aren't we just a little bit too close for those major carriers? And so,
Well, I think that is a good point, and that's true as far as it goes. But our strategy, we think, punches through that in a couple of ways. First of all, as noted, these destination routes, we plan to reach out to what are called point-to-point carriers. Like, I'm picking on Allegiant. So don't quote
they were here
that. I
before.
won't necessarily. They go from here and they go where they're going, and then they come back. So an advantage of that is that they're not network airlines, so they're much more reliable. They don't get disrupted if some plane in Milwaukee is delayed. They're just here to Phoenix, back and forth, whatever it is. Topekans are going to those places. The ability to drive 15 minutes instead of 50, pay virtually nothing for parking, and hop on a plane that's going to take you right to a place that many of us are already going, we think is a winning proposition. But there's something else that's new, and that is that the wonderful new terminal over there at MCI, it was exceptionally expensive, and it is imposing dramatic new costs on the airlines who are operating out of MCI. The airlines we're talking to would be delighted to have a route out of Topeka because it will cost them a lot less to fly out of here, and we will enjoy lower fares as a consequence. So you probably remember, like I do, that when United came to town, my sense of it always was, well, this is going to be nice and convenient. We might pay a little more, but it's okay because it's so convenient. In this case, we win one of these routes, it'll be convenient, and your ticket's going to be less. I would submit that fact scenario should get us over the hump you just described for those destinations. If you're needing to go to, LaGuardia or something, yeah, flying, driving over to KCI is still pretty stomachable alternative, but I think we can win doing it this way.
are there other counties in Kansas that have a setup such as the MTAA, where they're running airport authorities and economic development with the warehouses and the industrial parks? I mean, are there other models that we have in Kansas like this?
Salina is the closest analog I'm aware of, and we're in very close contact with them. Every situation's a little different. They, for example, have the base that they, let's just say, inherited from the military. And that's subject to all of the same strings that we have. You may have cottoned on to the fact that we can't sell any of our property, right, which has implications about talking to developers. Salina, that's true for part of their campus, but they have acquired additional property since inception, which doesn't have that red tape around it. So they have a type of industrial park which is growing in different types of ways. So by analogy, if we were to, say, buy the industrial park across Topeka Boulevard, just making this up, but we would be in a similar position to develop that in a more conventional way. But in many ways, Salina and Topeka are apt analogies for one another, yeah. I don't know off the top of my head. A lot of the airports I'm familiar with in Kansas are more like city departments or county departments than they are freestanding authorities. So I'd have to look. I'm not sure how many other, taxing authorities there are in Kansas.
On the industrial warehouses, how much empty space do we have that's left to develop, or what's available?
From a building point of view, we're doing pretty well. Most of our buildings are leased up. We've got one or two, 20,000 square foot buildings that aren't exactly crying out for occupancy anyway because they're fairly old. We're sort of wondering if it might be time to raise them and do something different. So building-wise, we're doing pretty well. From the standpoint of undeveloped property, we've got 196 acres kind of to the west of us that is just shovel-ready. Utilities are there. It's just crying out for development. And then if you look back into the airfield part, sort of if you look to your left just before you turn into Heartland Park, there's 400 and some acres out there that would need to be developed a little more strategically. It's not just open season out there because it's so close to the runway. But so, yeah, you're getting up to 500-600 acres that could be put to really good use by the right user. So,
Okay. All right.
So, a couple things. Commissioner Cook had asked about the property taxes. It's my understanding you guys are limited on the amount of property taxes you're allowed to levy as well, right?
yes, and there's a process that, I mean, we were all kind of in on the legislation a couple of years ago to expand our bonding authority, which implies a potential impact on the mill levies to pay the bonds off. But it's structured in a way that, for one thing, there's an overall threshold, which is a percentage of the county's valuation. Without the statute in front of me, I don't recall what it is, but there's a big cap. And then there are steps along the way at which we have to come and interface with with you all to make sure that we're in alignment about raising the mill levy to that extent. Without having it here, that sounded a little vague, but I think you understand what I mean. It's set up so that we don't have open shop. We have to stay in line with the
Right.
with
It's
the
not
county.
just, you can't just raise taxes willy-nilly, right?
Exactly.
So,
Exactly.
the other thing I was also going to comment on is I know, I sat in on the consultant's presentation that you guys had recently on commercial air service, and very educational. He had a lot of really good data. And I think what he had said is one of the big differences between us and Manhattan is we won't be competing for customers because their flights to Chicago and Dallas are really intended to be connector flights more than anything else. And so the objective of Manhattan is to get someone to Dallas so they can connect with a flight that takes them somewhere else. And these would be really just more destinations. Similar to, Allegiant was in town many years ago and had a flight to Vegas, I believe, at the time. So I know there are a lot of other new connector or new services besides Allegiant now in that kind of same budget airline vacation space. But
Yeah, and one of the reasons we feel optimistic about this strategy is that as a general proposition, those larger network airlines aren't really adding routes all that much. By contrast, those point-to-point carriers are growing fairly rapidly. So this method of traveling is popular, and those airlines are looking to expand. So the likelihood of being able to attract them here and fill their planes seems pretty high.
And Commissioner Mays, if I may, on the air service issue, as you know from the presentation, one of the huge issues is what they call the minimum revenue guarantee. And any airline that is looking at coming into Topeka Regional now is commanding a $2.5–3 million minimum revenue guarantee. And the MTAA has money that we're going to put up that's kind of first in, first out. But we're also, Curtis is leading the committee to solicit community involvement and excitement around this, because the other aspect of this is a SCADSky grant. It's a small community air service development grant that's available through the Department of Transportation. And the only way we'll get that grant, which would be a huge piece of this puzzle, is showing that community support and that we have the adequate funding to achieve that minimum revenue guarantee, which that grant can also help us get there as well. So.
Yeah. Okay, thank you. I did have a couple other questions on the Billard Airport. I noticed there was a logo on there for AeroWorks. Did Heinen Brothers rebrand? Is that what that is? Or
Actually, Heinen Brothers
They
sold to
sold.
the company that is called Technical Assistance Consultants. We just call them TAC, so it slows me down every time, TAC.
Okay.
You might know their owner, Tracy Blocker. That core company is one of the high-tech firms I've been talking about. They fly all over the country with $1 million remote sensors hanging off the bottom of their planes, hoovering up data about the continental U.S. and sending it to the Department of Agriculture, for example. So that's a strong, solid core business. Interestingly, over time, Tracy had, because when you run a business like that, you can't wait for somebody else at the airport to come fix your plane, pump up your tires, so to speak. So he brought on his own internal crew of what we call A&P mechanics, airframe and power plant mechanics. And when Heinen got into a position to transition out of that business, Tracy came along and bought it from him. He's already got the staff. He moved into their hangar. He's fixed it up. He's done some really nice remodeling work in there and developed this entity called AeroWorks that's doing a really excellent job of filling that space. We're very proud of Tracy and his crew over there.
that's great. I hadn't heard that yet. Kind of also at the Billard Airport, I noticed you talked about the fence, but it looked like it didn't go around the KHP hangar. Are they not wanting the secured perimeter, or?
So technically I don't know about wants. I can't say, because I haven't been in those discussions, but technically speaking I get to use the thing that Stephanie showed me here. The blue roof there, which is the KHP barn, and then that parcel just to the south of it is not our property.
Okay,
Years ago, for reasons that are obscure now, that property was sold to the state, and so it's really not our place to put a fence there. Our
Okay.
fence is about our perimeter.
that explains it. And then the other question I had about Billard was the T hangars have always been something that we've heard about. I know a few of them are almost pre-war, I believe, like built in the 40s and in pretty bad shape with dirt floors and whatnot. And airplanes are pretty expensive. I think typically airplane owners want nice accommodations for their equipment. Is there any work on getting those either replaced or renovated?
So that has been a huge focus, Commissioner Mays, on, number one, addressing tenants' concerns regarding the T-hangars. And I think a lot of those issues that we've heard about over the last year have been addressed. The T-hanger bank that you're referring to, that 40s era dirt floor, problematic is the east bank that you can see that's right west of that 1836 runway right there where Curtis is pointing. Those have recently gone through, and I say extensive renovations, but not extensive, but they fixed doors. We put a new ceiling on the roof, worked on some electrical. That would be the bank that we would definitely be looking at replacing first, if we do. Obviously, funding is an issue, but with the bonding sources we have and other things, we're looking at a global package at Billard to try to improve things. And then as you can see to north of the highway patrol, can you point that out up there? We have that, some of that vacant space there. That's an area where we're looking at potential new hangar builds at some point in the future as well. But I can report to the commission that we haven't received many complaints from tenants regarding the hangars recently. So I think a lot of that has been addressed, thanks to Curtis and his team.
Good. And then at one time, maybe a year or two ago, I had heard that there was going to be a renovation of the old stone hangar out there. Did that ever happen, or what's going on with that?
The stone hangar is under lease to Heinen, and it's a fairly long-term lease. I don't recall the expiration date, but it's out in the 30s. And they are using it to store aircraft. According to the terms of that lease, they have a series of scheduled improvements they need to make, and they have made them on track, and those will continue to play out. So we don't have a strategy that's already baked into their lease.
Okay, and then the last question, I'm going to go to Forbes, and I saw, you know, you had your MRO slide with plans for the 777 NIAR project. At one time, I had seen plans where it was going to be large enough to accommodate 2 777s. Did that change at some point to where it's just one now?
Now, I think the structure could accommodate 2. There's just one drawn there, I think, for scale, but it would depend on how you pull the planes in and how you park them. And it won't necessarily always be 777s. You could, in fact, get like 4 737s in there and work on them, et cetera. So the point is a space that big would be very flexible, and they're in high demand.
Okay, thank you. Did you?
Yes, Chair, thank you. At Forbes, the terminal, if we were to get a carrier out there, are we ready to go? I mean, is everything in place where we wouldn't have to do any major modifications or changes?
We have a jet bridge that is relatively new. It just became operational last year, so that's ready to go. The terminal looks great. The one thing that's going to require a little bit of work that'll be done by the TSA is the reestablishment of what they call the sterile area, which I think is an unfortunate choice of words, but that's where you go after you've passed through security and you're waiting for your flight. So that is sort of inactive at the moment. That'll need to be stood back up in the security equipment, but that's mainly a TSA project.
And Commissioner, we are ready to roll. The only thing we are looking at too on the terminal facility is upgrades to the HVAC system. We did just commission a study on that as well, but that wouldn't prohibit us from being operational anytime soon.
Okay, last question. Is there any interest in having a company like, say, an Amazon or somebody like that using this as kind of a jumping off spot? It just seems like we're here in the middle of the country. We have space for warehouses or whatever they might need in an airstrip that's not being used all the time. So.
I think that is a terrific part of the futurescape, and in order to make sure we're ready for that, I can tell you that we have been in conversations with the people that bought Heartland Park, and basically established a line of communication and a sense of understanding that if they land a tenant like that, we'll be at their disposal in terms of what needs to be done to give them the best unobstructed access to the airfield that they can get. So the answer is yes. It probably wouldn't be us because a company like Amazon, as I understand it, would typically buy their property and own it and build their big structure on it and go from there. And you can't, with us, we can't sell our property. But if somebody right across the street did that, we'd be ready to go in terms of, whatever it took to get them in the air. And the people who own Heartland Park are well aware of that.
Okay. Either? All right, well, thank you guys for being here. It's very educational. I appreciate it.
Thank you.
Okay, thank you for your patience, everyone. I know that the health department and Grace Med are ready to go. So let's go ahead and move on to the aid to local grant application with Teresa.
All right, good morning, Commissioners. Teresa Fisher, Director of the Health Department. And this is the second year that we are bringing the Aid to Local grants back to the work session. Historically, we presented this during a BCC actual meeting. And so this is an opportunity, we're going to do a deep dive into all of these grants. By far and large, these are the majority of grants that we have throughout our department and our various programs. So all of the grant managers are here today. They're going to be presenting their own slide deck, because they truly are the content experts in those areas. We also have Kathleen Burrows and Amanda Neosi, who are the finance team. They are the two that worked hard on crunching numbers for the budgets that you'll see throughout here as we go on. So with the programs, you're going to hear about the programs. They're also going to tell you not only what the programs do, you'll hear about the staff that make up those programs. They're going to talk about if there's a grant match required for some of the grants, and if so, how much these are, how the grants are funded. Some are competitive, some are formula-based. And then as we move through the slides, this year, not any different than last year, you'll see that most of our grants are still not keeping pace with our staff salaries and benefits. So I'll kick us off. This is just our overarching numbers, and again, they're going to walk you through all of these and what comprises this. So this is for state fiscal year 26. So our total grant request this year is $1,579,831. You'll see this is well over what we requested last year, and they're going to give you a breakdown of what comprises each of those dollar amounts, and then you'll see the amount that we received last year. It is not atypical that we request more than we receive. That's pretty standard, I would say, but we always like to put forth the request to look at what the true operating cost is in the hopes that we will receive some additional funding through the state. And with that, we're going to kick it off. I'm going to turn it over to Craig Barnes, who will be up first for his slide deck.
Morning, Commissioners. Craig Barnes, Health Department. So I'll slide through. I've got the first four programs that we'll talk about. The first one here is our child care licensing program. So this is our regulatory program that licenses all of our child care centers and our home daycares, as well as school drop-in programs, as well as summer school camps and after-school programs in our community. So as of right now, we have about 296 licensed facilities in Shawnee County. Each month, we're doing orientations with prospective providers. And so, for example, last month, we had 3 orientations with prospective providers. So we're still looking at increasing those numbers across our community. So what you'll see here is the grant request that we have, which is $381,386.30. One of the interesting things about this grant with KDHE, as Teresa alluded to kind of on this one, the slide back here, where we requested and what we received, child care licensing as a part of this grant process requires us to present an entire operating budget. However, KDHE does not ever, as far in my 12 years with the health department and long before that, has never covered the program at 100%. And so you'll see when we request that amount, we will not get funded that amount. KDHE funds this grant on a formula. And you'll see from this slide, I kind of talked about this here, you can see very statically, the blue there is what we have been funded since 2019. So the dollar amounts have stayed relatively consistent, only changing about 20,000, and our fluctuation in what our overall program dollars to operate the child care licensing program have been. There's in the orange there. Okay. So the next grant here that we'll talk about is our Chronic Disease Risk Reduction Grant. This is the grant that drives a lot of our policy systems, environmental changes as it relates to tobacco use prevention, the physical environment, as well as nutrition endeavors within our community. So you've heard me speak in front of you and present in front of you for a lot of different initiatives over the last handful of years as it relates to this program. For this year, we are looking at 4 specific grant activities, and we are requesting $107,407.19. This grant, as Teresa alluded to, is one of the grants through the Aid to Local that does require a match, so that's a 25% match. So the total program costs for this next fiscal year that we'll be looking at is $135,687.98. So as I alluded to, we are looking at 4 specific grants. This is a competitive grant. So unlike the child care licensing, which is based just solely on a formula, this one is a competitive grant across the state of Kansas with different communities applying for the same pocket of money. So you can apply for up to 5. We will be applying for 4 in the realms of our Safe Routes to School work that we'll be continuing into this next grant year. Work again with school districts as it relates to their tobacco and vaping prevention projects, as well as starting in some work. A required grant activity for this next state fiscal year is to look at activities focused on equity and those priority populations in the community. So we will be looking at a grant activity that will be focused on prenatal education and tobacco cessation with new mothers and expectant mothers in our community in a partnership with the Topeka Doula Project. So here, this slide just shows kind of a year over year, the grant for salary and fringe benefits. So the red there is the cost of the salary and fringe, and then the blue. You can see after where we had the COVID year there in 2020, we were already within that state fiscal year, obviously, but we did reduce the kind of, I guess, the ask and the work that was happening through this community engagement grant during those years, just because a lot of our staff was diverted to other duties within the COVID response timeframe. But you see that we have diligently worked since the conclusion of the COVID pandemic in our ICS structure for then bringing more dollars back into the grant through that blue that we've requested since that point in time. And so for, again, what will be the 4th year in a row, another requested increase for our grant, and we have received that increase each of the last 3 years. Not the entirety of what we've requested, but continue to see that amount increase, and we expect to do so again this year. All right, the next 2 grants that I will talk about tie really hand in hand. These are our emergency preparedness grants. So we have one, which is our local FEP, or our Public Health Emergency Preparedness, and then our regional one. Last week on Thursday, I came to you all to ask for approval for our Aid to Local Regional FEP. That was thankfully approved by you. We have already submitted that grant for this fiscal year. So the ones that I'll first talk about here is our local public health emergency preparedness. So this is a grant, again, that covers our expenditures. It's really all staff. There's not really any I would say operating expenses in here, just because, again, as Teresa alluded to at the beginning, the grants have not kept up with kind of the cost increases to salary and benefits and things of that sort. So that salary or the grant funds that we have received has stayed pretty consistent, and we'll show you on the next slide here. So again, we're requesting $110,191. This grant is, again, a grant that's based solely on a formula. KDHE gets that formula to us. It is based on CDC's vulnerability index, the population that we have, and so does not change for us. With this, we work on focusing our planning aspects of a lot of the plans that we had created prior to the COVID years helped us to ensure continuity of operations into COVID. It is also the entity, our primary coordinator for our local FEP grant, also coordinates what's called our ESF 8 Annex, which is Emergency Support Function 8, or our medical annex. And so this is the entity that works very closely with emergency management and coordinated through our LEPC, or our local emergency planning committee. And so we oversee one of those 15 annexes within our community, which is to coordinate then with the hospitals, long-term care facilities, and anywhere if we had like a mass casualty event to assist in helping our partners with finding additional beds if we needed to do additional triage and things of that sort. Okay, so as I alluded to, this is, you'll see the blue line pretty consistent across the board there, and then the red line is our salary and fringe benefits that go along with that. Okay, so regional FEP, I won't talk too much about this since we talked about this just last Thursday, but you can see the corner up there, that is our Northeast Corner regionalization initiative. Pardon my language there. So we are the fiscal agent for the funding for that. We received this. This is again based on a formula from KDHE. We are, like I said, the fiscal agent. The money comes here to Shawnee County. It pays for a portion of a staff member here that is the coordinator for our region. But the money is diligently provided out to our partners in the more rural communities to assist them with their operational expenses and their planning aspects. We will actually be conducting our regional exercise tomorrow up in Holton with all of our 7 additional partners for all 8 counties as a part of our requirements for our regional grant. And so we help assist and kind of run that. We have trained our EPCO specialists diligently over the last 6 years to assure their ability to help both design and evaluate exercises, and then to assist in also creating the after action reports and the improvement plans to improve operations for those other 7 counties in our region. Like I said, funding is based on a formula, just like local FEP, and likewise, you'll see with the blue there that the funding itself has not shifted tremendously over the years, and then the red line there is salary and fringe. So, I don't know, questions to the end? Or any questions for me and my 4 program areas now, before we dive into the next grants?
The child licensing,
Yeah.
our regulations, are they handed to us from the state, or do we have our own regulations, or how?
So yes, so there's been a lot about child care regulations in the last couple of years, but yes, the state provides us the regulations in a large contract in which we have the duty then to uphold here in a local. So we work very closely hand in hand with our state counterparts to enforce the regulations that they've set for us. Mm-hmm.
How much of a shortage do we have in child care in Shawnee County?
Yeah, it's a great question. So we do have, I would say we still do have a shortage. I think grant opportunities that have happened over the last handful of years through the Accelerator Grant have assisted, and we have done a lot of orientations. One of the things that we need to then move to the next step is those orientations with prospective providers, then into opening up actual care. So we still understand that we have a child care desert in our community that kind of starts in central Topeka and then kind of creates a cone out towards the southeast. And so one of the things that we are diligently working on within our program is opportunities to look for additional partners, to increase orientations, free orientations in our community, also training opportunities so that providers feel that they are well equipped to be able to do that, and looking at even partnering with some of our local entrepreneurship organizations to provide kind of entrepreneurial training for providers that look at either opening home-based care or child care centers. One of the things that we identified through our community health needs assessment when we did our first ever focus group that focused solely on childcare was kind of that training and that institutional knowledge gap. And so that's one of the things since we had that focus group in the fall of last year. And so 6 months ago, we're really working on trying to shift our programmatic thing, less just on the consultations and the inspections and things of that sort, but also on building and helping find opportunities for new providers to create opportunities for care in our community. Because we know it's a big economic driver for our community. If we can find safe, licensed care for us in our community, more parents have safe places to put their kids, more opportunities for parents to go back into the workforce.
Thank you.
Sure. Yeah.
Craig, I'm noticing that a lot of your grant requests are less than the total program cost.
Mm-hmm.
Is that by design that we need to ask, or we need to spend more than the grant, or is there a way that we can trim the program so that it is completely grant funded and not subsidized?
Yeah, that's a great question. It's something that we diligently look on year after year. The child care licensing, so one of the things that Teresa and I have been looking at really closely and working with trying to figure out what kind of the recommendation for a specialist per licensed providers in our community. And so NARA, which I'm going to blank on what that acronym is, I apologize. I think it's the National Association for Regulatory Administration, something like that. I apologize, I can look that up. But the recommendation from them is that you have per specialist in a licensing agency, 50 to 60 providers in a community. And just looking at childcare specifically right now. For us in our community, we have 97 providers per one specialist.
I guess no. It wasn't a great question because that's not what I was asking.
Okay.
That was not a great question. So I was asking, is there a requirement that it's a 80 to 20 match to where the county is putting in 20% to a 80% grant? That was more my question.
So for chronic disease risk reduction, that is a
Well,
75% for that. But
just-
for the others,
Okay.
based on the formulas, we're not going to get to those dollar amounts.
I mean, I just didn't know, like, if you look at the child care licensing,
Mm-hmm.
requesting 381, 386, program cost 392, 400.
Mm-hmm.
If you go on to the next one that you had, keep going. There we go. If you go back to the chronic,
Yeah, this is, you want the
okay.
All right, here you go.
There you
Yep.
go. Requesting 107, costs 135,
Mm-hmm.
and we continue on, that the total cost is more than what the grant is, and that's not a requirement that we commit more than what the grant is. It's just that it's going to cost us more than what we think the state will give us.
Correct, yeah. So chronic disease risk reduction here, what you see here is for total program cost includes that match, so that does equal out to the 100% there, but for the other three grant areas, you are 100% correct.
And so I didn't know if there had been a discussion when you turned in the grant application that you had talked about keeping the program cost at what you were requesting. And the answer is no, we did not do that.
We
We
did not.
looked at what the program cost was. And so
Yeah.
we did not look at trying to keep it within the grant request.
Correct, yes. Sorry, I took it a lot more granular
Right,
than that.
thank
Any other questions?
Any other
for Craig?
questions for me?
All right, thank you
All
very
right,
much.
thank you.
It's 1
Okay.
hour.
So it's time for us to do our standing time, so you get the awkward presentation.
No, I thought everybody was just really excited about this. I'm Carrie Dowse, I'm the Clinical Services Division Manager with the Health Department, presenting on my two aid to local grants. My first one is family planning. This grant really focuses on assisting individuals and couples in planning the number and spacing of their children in hopes of contributing to positive birth outcomes, healthy families. This is federal Title X funding, and family planning is viewed as a basic health service essential for the promotion of optimal family health. So our requirements for this grant, ensuring that we've got the staff, equipment, and knowledge really to provide these services. We do maintain an advisory committee to review information and education that we would share on the program. This grant also comes with different compliance issues with 340B. It's a federal pharmacy program to provide discounts on drugs so that those savings can be used within the program. As you can see last year with our budget and program expenses, we were really for the first time very close. This grant does require a 40% match. State formula, this one is a formula-based grant, so it's based on our population and then the tax allocation that the health department receives. Historically, this grant has been used to fund the salary and benefits of staff within my division. I will also note on state formula, this one is pretty wide open as to how the health department can spend it. It does not have some of the same requirements as other grants. And then finally, our immunization action plan. This one is formula-based. Oh, there we go. We have based this application on last year's. KDHE is still working out their agreement with the federal government. So they weren't exactly sure what the allocations would look like this year. But in the past, it has been based on the number of children in Shawnee County enrolled in Medicaid or CHIP, and then also looking at the number of vaccine for children doses that we had administered in previous years. To apply for this immunization action plan funding, the grantee does have to be enrolled in the Vaccine for Children program. And then you can see there, we gave nearly 3,500 doses of VFC vaccine to just over 1,100 children. Any questions on my grants?
Any questions?
No, thank you.
All right, thank you.
Good morning, Commissioners. Misty Middendorf with Family Health Division Manager. I will be talking about a maternal and child health grant. This is also aid to local. So this year we're requesting the $390,530.41 from the grantors, and this one requires a 40% match, and so that would be the $207,260.30 for the total program costs of $597,799.71. So this program for maternal child health includes our first steps, which is our social workers that do home visitation, our baby basics, which is our prenatal education classes, newborn and postpartum home visits, which is delivered by a registered nurse, and then we do community outreach, and then we also have our fetal infant mortality program under this grant. This grant continues to be formula-based grant funding based on the population of your community for children 0 to 21 years old, females 22 to 44, and then the number of children under age of 16 living in poverty. So some of those, as you know, we don't have control over. This is our year-over-year grant versus salary and fringe benefits. We had stayed the same for quite a few years, and then 2 years ago we got an increase. This was based because they gave extra dollars for what they were calling home visiting. We had always done home visiting, but it wasn't required with our maternal child health grant, but that's what we chose to use our dollars on. So we got an additional $10,000 the last 2 years to put just to home visiting salaries only, so those did increase. And then the grant will cover staff-wise a portion of my salary. I'm under numerous grants, full-time team leader, 2 full-time social workers, 1 full-time RN, partially funding a office assistant 3 and our Spanish interpreter. And then we recently came to you and requested that one of our positions that was a nurse be changed to this bilingual family health navigator. So that will be a full-time position under this grant. And then I've just also thrown in some 2024 numbers based on home visitation. It was 545 encounters. Baby Basics participants. We have lots of people that come to Baby Basics, but the goal for KDHE is that they complete 4 or more of those 6 classes. So we had 57 complete that, which is really good because when we first started, we were getting about 20, 25. So we've really grown the program. In fact, we have a class starting in 2 weeks, and we have 23 participants signed up, and our cutoff is 25. So the word's out there. And then we did reviewed 18 cases for our fetal infant mortality review. And then we do numerous outreach activities, which can include our car seat check lanes, community baby showers. We also do like a boo at the zoo. We do the read and roll events. We do Baby Jubilee at Stormont Vale. So we have tables at all these events where we're encouraging participants to come see what we have at the health department, especially in maternal child health. Be more than happy to take any questions.
Any questions?
No,
All right, thank you.
thank you.
All right. right, so this is our last slide. This just kind of looks at all of them. So a couple things I would draw attention to is we do have workforce development up here. That was not talked about today. That is actually a multi-year grant that you all approved a couple years ago. And so that is just a carryover amount that runs through 2027. So that one is a little bit separate than these regular aid to locals that we do look at. I would note that we continue to look for grants to fill some of these gaps. We are well aware that the operating cost of some of these programs is more than that we typically would ever receive. Some of the staff have told you, some of these things that are formula-based are obviously out of our control. And so we can't necessarily negotiate on those. I think to your question, Commissioner Cook, about looking at the different programs, I feel like we run a pretty lean staff as it is. And some of these departments are running with continual vacancies, unfortunately. And so that's probably, in all honesty, how we've made some of these things work a little bit more when we have those vacancies, because salaries and bonnets are covered under the cost of the grant. So when we have a vacancy, it frees up those grant dollars to be able to cover more. But continuing to look for those, the challenge becomes if it's the same work that we're doing. There's always looking at grants and whether we're going after grant dollars and it's completely different work, or if it's closely enough related that it would be able to be embedded in the work that we're already doing. So those are things that we continue to look for. The eCivis software that the county purchased is still relatively new to a lot of us. We've got a couple that are definitely more knowledgeable, so that's a goal we have as a department, is to continue to educate ourselves on that and be able to use that to see what grants might be out there. Routinely talking to other health departments, and the funding that they receive is also a part of my work. But these will be on Thursday's BCC agenda, so you'll see the full packet then. This is my time to say thank you to my team. These grants got released in January, and it's been full force ahead for all of them. And these are just the individuals represented here. A lot of their teams have also been working on these that are not in attendance today. So this truly is, besides our departmental budget, largely what makes up our funding.
Right.
Other questions that you all may have?
Mr. Chair.
Yeah.
Just, I think that what we look at is you do run a very lean team. You run a very strong team, and the health department is highly respected. And that was not meant to criticize the health department, but it's looking at where the county, 85% of our budget comes from property tax. And with the legislature, again, they're very keen this session, and have been for the past several sessions, at looking at making huge changes to the mill levy calculation or property tax assessment. If we were to see a major shift in our funding, we have to be prepared to shift with it. While I knock on wood and hope that there are not major shifts, that we are able to work within our budgets, we have to prepare for all different things, as you well know, and I would rather us be looking ahead rather than being caught by surprise. Being planned, being proactive instead of reactive, if you would have. And so those are the things that we look at, is where are we contractually bound or statutorily bound, such as an 80-20 match, which are ones that we aren't bound by, and looking at if we lose a funding source, what are we going to do?
Absolutely.
And so those are the things that concern me as a commissioner, is how do we maintain continuity of government if we were to have a shift in funding? So.
Any other questions?
I'm good.
Okay. Thank you very much.
We'll look forward to Thursday.
Thank you all for being here. Okay, we'll move on to our next item, which is our update for Grace Med.
Good morning. My name is Dr. Julie Elder, and I have been the Chief Medical Officer at Grace Med for the past 11 years. And then in December, I took over as the CEO. I'm still wearing the Chief Medical Officer hat, but I'll pass that to the new CMO in June of this year. So I just wanted to give you a brief rundown of 2024 for our organization. And as most of you all know, we are a faith-based, Christian-based medical ministry, and we're here to provide medical care, dental care, and behavioral health services to our patients and share the love of Christ through the care we provide. We currently have 9 staff here in Topeka. We have a pediatrician, Dr. Jepson, a podiatrist, Dr. Ely. Matthew George is our behavioral health specialist. Dr. Huffman and Dr. Randa are our 2 dentists. Dr. Judd is an optometrist. He spends part of his time up here and 2 days in Wichita. Dr. Blaker is a family medicine physician. Audrey Hunter is a family medicine nurse practitioner. And then Tim Bredehoft is our PharmD. He runs our 340B pharmacy that is in-house at our Capitol Clinic. Over the past year, we've had a year of transition, changes in leadership. We're still post-COVID, but our staffing, you will see on this slide here, has diminished post-COVID. We, just like many other healthcare institutions throughout the country, have suffered from workforce shortages, and we continue to encounter those challenges in the medical realm. We currently have 9 providers, like I said, and that is compared to 16 when COVID was in full force. So we're continuing to recruit for providers. We've changed platforms in how we recruit. We've started planting seeds in educational partnerships, starting to train newer physicians, new graduates from APRN programs. So we're finding some workarounds to those staffing shortages that are not quick fixes, but they're going to get people excited about what we do and the patients that we serve. And we're hopeful that they will continue to draw patients providers, into the medical careers that we've seen in years past. In 2024, we had a total of 9,682 encounters, and that's compared to 13,511 in 2023, and that's very reflective of the number of providers and the staffing shortages that we see. We have to have providers to have that open capacity to take care of patients. But you'll also see on this slide in 2024 that the number of self-pay patients went up for the year. So we're seeing a lot of folks who desperately need care, and they need it to be at an affordable price. We did see a decline in our Medicare patients and in the private pay patients as well, but overall, very reflective of the number of providers that we have. Our dental encounters have gone up for the year. Again, the number of self-pay patients has increased, and it just drives home that point that what we do is so critical to this community. We need to be providing these services at affordable rates for our patients. And we've been able to add to our dental assistants, which our dental assistants augment what our dentists can do. When our dentists do not have dental assistants, they can't see the same number of patients that they would in combination with their help. And so we have been able to add to our dental assistant staff. Yes, sir.
I noticed on the Medicare for the dental in 2023, it was 0. Did they not pay for any at that time?
Yeah, that's a good question, and I'm sorry, I can't speak to that exact number. I can't explain that. That I noticed that on that slide this morning, so that may be a typo, and I apologize about that. We predominantly see white, non-Hispanic patients. However, you'll see from this slide, the white patients make up about 27,000, Black, African American, right under 4,000, and we did see an increase in our Asian population in 24 compared to 2023. As I mentioned, we predominantly see non-Hispanic Latinos, but about a third of our patients are Hispanic or of Latino ethnicity. And our main age group is from 18 to 64 years old. That's our predominant patient, but we certainly see children under the age of 18 and folks 65 and older as well. The majority of our patients speak English, but about 20% plus or minus speak Spanish. So we utilize Voice, which is a company that offers translation services for patients, It's a video with a live person on the other end. They also provide sign language services as well for folks who are unable to hear. And they also provide translation for many other languages, and you'll see that we see a good majority of patients, not just with Spanish, but other languages as well. And we're able to communicate with them through this translation service called Voice. So that gives you a very brief overview of what we've been doing this past year. A lot of transition, a lot of restructuring, a lot of changes within our organization, but I am happy to say that we're continuing to move forward one step at a time. We've been able to do a lot of exciting things, even though we've been in a year of transition. We have even implemented heightened security. We've all heard of the security breaches around the country at different healthcare institutions and organizations, and we've implemented an upgrade in our electronic health record, which has heightened that. We've implemented dual-factor authentication, again, another layer of security for our medical record. We've opened up a patient portal, which heightens communication from patients to their healthcare teams. We've also begun texting our patients about their appointment time, so a lot of improvements along technology and under that umbrella. We've also opened up some communications and collaborations along the educational pathway, like I mentioned. We've partnered with our state, our Community Care Network of Kansas, that's our primary care association through the state, for a nurse practitioner fellowship. It helps give a little extra training to new graduates in the clinical realm. We've also started a medical assistant training program internally, and that's, again, through partnership through our Community Care Network of Kansas. So that offers professional growth and development for staff who want to join in on the medical side of things. And so we're getting ready to also implement a dental assistant training program internally. So some exciting things around the horizon and some exciting stuff going on. So with that, I'll entertain any questions.
Questions?
I have a question. Have you guys looked into any program where doctors would actually volunteer their time to work?
Yes, actually we do. We've been in communication with one local physician who's semi-retired and wants to give back. So we have, and we do entertain that when they come along. Yeah.
So I noticed there's been some, looking at the slides that you shared, which showed 2023 with 2024, there's some pretty big differences in the populations that you're serving. Is that almost entirely attributed to the staffing levels, or, I mean, is there a new goal that you guys are trying to accomplish by doing a different demographic, or?
When you say, are you talking insurance status, or are you talking?
No, just on those last couple of slides, which showed, you know, the ages and things, and it looked like, I mean, some of those, I mean, you've got half as many people that are over 65, and I wondered if there's a reason for that, and you've got double the number of people under 18, or triple almost, actually. So, I mean, are you guys shifting the focus that you guys are working on, or is there a reason for that?
We serve all patients, you know, regardless of their ability to pay, regardless of their age, you know, their background. We serve everyone, and, you know, so we're here for the community. I think this really reflects staffing shortages, truly. And when we have more staff, which you've seen in years prior, we have larger capacity. We have more ability to take care of folks and see more and more people. You know, the uninsured folks don't have a lot of options in the community for care. And so we help them with a sliding scale, we make it affordable, but insured folks can pretty much go wherever they need to go and to get that care. So I think that's also reflected in the slides that you're seeing and the numbers that you see year to year.
Okay, thank you. Any other questions? No.
Okay.
Well, thank you for being here today.
Thank you.
So that concludes the majority of our agenda today. So we will move on. I don't have any public comments signed up. Do we have any administrative communications that need to be made? I'm not seeing any. So then our next item will be executive session. So I would make a motion that we go into executive session for personnel matters of non-elected officials. Specifically, we're going to be doing some employee evaluations today. I believe we are looking at, what was it, an hour and a half?
Till
to
12:30.
2 hours. So we'll be going until 12:30. That will start, let's just say, right at 10:30. So that is my motion.
Second.
Motion by Commissioner Mays, second by Commissioner Cook. Those in favor say aye. Opposed, motion passes 3-0. We will be in executive session. We good?
Yeah, we got quorum.
Okay, well, we are back from executive session. No action was taken. We're adjourned.